So patients want to know, can osteoarthritis, especially affecting your knees or your hips, can that ever be reversed? The short answer is no. Osteoarthritis is a permanent degenerative disease, meaning that it eats away at the bony structures of your joints, whether it's the surface of the bone or the cartilage or the ligaments. It starts to actually erode this in a permanent manner. So you can't ever reverse osteoarthritis, even though there's claims made by injecting certain types of cartilage and things like that. It doesn't reverse the osteoarthritis, the damage that's already been done there. What we can do is significantly reduce or prevent osteoarthritis from happening. And so a few things that you can work on that can significantly improve. So the knee joint and the hip joints, they're joints that are weight bearing. They're joints that are taking the weight of pretty much your entire body. With respect to the knee, it's really a bone on bone type of joint. And so anything that can relieve the pressure off of that is going to be a huge thing to consider. So number one thing is weight reduction. The less you weigh, the less pressure it's on these joints, and there's less wear and tear. Number two is strengthening the structures around it, the muscles and the tendons and the ligaments. If those are really strong, then that's going to redistribute the weight not on the joint but on the muscles and tendons. So quadriceps and hamstring muscles, stretching and exercise, the calf muscles, all of these muscles and those tendons kind of help support the knee joint. So strengthening those, doing low impact exercise, right? So instead of running and jumping like playing basketball, move on as you're getting older into sports like swimming or bicycle or elliptical. Those are going to reduce the wear and tear of that joint. And then lastly, you got to remember osteoarthritis is an inflammatory disease, meaning that if you have inflammation in your body, this is going to accelerate the process. So what causes inflammation in the body? All the processed food that we're eating, fast food and the processed food causes inflammation in your body, and that makes things like the joint. It's not something we always make a connection with, but can definitely make that osteoarthritis, the speed at which it happens, much faster. So hopefully you found all this information helpful. Certainly, everybody's going to be different, so the best thing to do is to call one of us or come in and see us, and we can individually look at your health profile and see what we can do to kind of improve your chances from not suffering with osteoarthritis or significantly reducing the progression at which this is happening. So hopefully you found this information helpful, and we look forward to seeing you. Take care.